Testing scapular protraction against gravity position. Patient will be supine. They can also be in a seated position. You can do either, but I just like to have them in a supine position because the scapula is better supported while laying down. So Owen, what I want you to do is I want you to bring your arm up and I want you to punch towards the ceiling, but make sure to keep your elbow straight. So go ahead and punch forward and now back down. Because he was able to do this against gravity, I would rate that as a 3. Now I'm going to grab on the distal end of the humerus and I'm going to push him into retraction. So go about halfway, Owen. Yeah, there we go, about halfway. And while stabilizing the scapula. So I'm going to resist me, 3, 2, 1. Let your arm back down. And depending on the resistance that it gives me, I'll rate him as a 4 or a 5. Testing scapular protraction, gravity eliminated position. Patient will be seated, forearm supported. If we were not in a clinical, or if we were in a clinical setting and I did not have a platform such as this, I could support him with my hands. But since we have it, we're going to use it. Okay, what I want you to do is, Owen, is I want you to punch forward but not bend your elbow at all. Okay, so just punch forward and then come on back. Because he's able to do this with gravity eliminated, that is a 2. If there's no movement, I would palpate for the serratus anterior, found about right here. If I feel this muscle firing, that is a grade 1, and if I do not feel that muscle firing, that is a grade 0.